Welcome to Dental Assisting 101 again. We are doing an actual video on crown preps. The last video was on a composite setup. The setups are very similar, but I just added some items, so let's go over that. All right, so down here, once again, I'm gonna go over it just quickly, and then we move on to the actual crown prep material. So we have our basic setup, which is a mirror exploring cotton plier. We have our actual spoon excavator. We have our condenser. We have a football burnisher. We have both ends to that, small and large end. We have a composite instrument, plastic instrument. They call them two different things, but it's used because we have a paddle on this side, and then we have the condensing part on that side, which is very convenient. We have a carver, which is used to remove excess material in between the teeth. Another word for is interproximal, in between interproximal. Here is a scaler used for extra access. Anything extra material that's on the tooth, it kind of pops it on off for us. We also had already went over the actual articulating forceps. We have articulating paper. You know, we open it, we close it, we have it together. That's articulating. Those are used to check the occlusion. We have our high-speed handpiece, our slow-speed handpiece, which we talked about earlier. We have a spatula here, which is used to mix material with. We have our aspirating syringe that we also use to numb the patient with. We have a yellow, which is a long needle, blue, which is a short needle, lidocaine, red strip, that's how we know that's lidocaine, so we're going to move on to that. This is actually a actual tray that we use for a preliminary, which means before the final impression. That's what we use for that. That's actually for an anterior, if we're doing an anterior tooth, 8 or 9 or 24, 25. Here, now we're moving on to the crown prep stuff. Now, listen here. This is actually what a preliminary looks like when we take it on the patient, okay? Yes, it is clean. I wiped it down, sprayed it, all that good stuff. So it's on the, this is for posterior teeth. Posterior, you see it? Anterior, all right? I want to put this back on because this is usually the final that comes from the lab. See how that occludes? Everything fits great. Usually the permanent crowns come out on that. So we use those all the time for demonstration for students. This right here is your burr block, of course. Mouth prop. Next is your crown prep scissors. This is used to cut cord. You need to cut retraction cord. This is used to remove anything that's in the mouth, so far as any instrumentation type things like a matrix band or wedge. Then we actually have, we're going to move over to here, and we have the actual material, okay? This is like a heavy body material. This is used during the final impression, all right? This is actually like a light body type of material, and we use that also during the final impression. This is what we put on around the gum tissue of the tooth before we actually take the impression. All right, now, Blue Bite. Blue Bite is used, of course, for the preliminary, which we used the first time, but I showed you down at the bottom. This is Blue Bite. Then we have MaxiTemp, which is a temp material that we also use. It's called MaxiTemp. We use this to make temporaries, which is amazing. And don't forget about your temp bond, which you use once your temporary is made. That temp got to stay on, so that's temp bond we use for that. Also, we have our PPE. Always never go home without it. That is your goggles and your mask and your gloves. And then also, last but not least, we have our shade guide. And then this is your light curing light, which is also used because if you're doing a core buildup, we use that to light up material. Now we're going to pretend that we actually have core buildup or we don't have core buildup material, because we're going to move over here, which is composite. So dental assistants out there, don't panic if you run out of, if you're working on a crown prep and you don't have any material. Oh my God, I don't have any core material. Ask your doctor. Doctor, is it okay, because it's on back order, we can use composite? Sometimes they will say yes, sometimes they will say no. But don't think it's the end of the world just because that happens. But guess what? As a dental assistant, you need not to run out of anything. All right, so with that being said, that is all for this video. I appreciate you guys taking the time to watch this video. Dental Assisting 101 Crown Prep video. Can't wait to see you for the next video. Woohoo!